Welcome to all of you with an interest in healthcare and health IT. As we bring some predictions for this year, we hope that you have some strong takeaways on how this information will help you and your organization in our journey to transform healthcare. Today I'm with Ken Rosenfeld. Ken is currently the CEO of Authentic Strategies LLC, a digital health company. You can see our bios on screen. Ken, you want to add a few words?
Sure, sure. Yeah, happy to join you, Phil. And yes, I've been in the healthcare information technology and digital health industry for over 33 years. And I founded eHealth Technologies and most recently have, as we've scaled that company and had a lot of success, have now moved into a new area where I can support lots of different organizations and supporting their growth in the very exciting digital health industry.
Yes, and I really appreciated what you did at eHealth Technology, the ability to pull together records for care so that fragmented health records across the country could be pulled together so that patients could have a unified medical record that could be used for consultations and ongoing care. So great job over at eHealth. We look forward to hearing your new adventures and what you have planned in your journey to transform healthcare. Well, let's get on to your 7 predictions that you published about a week ago. And I thought they were very interesting. As I talked to them on the screen, what I want to do is break each one of these out and we'll discuss what they mean and how they impact our audience. So go ahead, Ken, tell us a little bit about, first off, what are social determinants of health?
That's a great question. And I think there are a lot of definitions out there today, but one thing that's indisputable is the fact that there's a lot more conversation about this very important aspect of healthcare in general, which goes beyond just the standard healthcare provider providing care for patients, and the dramatic impact and significant impact that that the social determinants or the other areas that impact a patient's overall health play in their health and in their ability to improve their health care. So social determinants of health.
Having a dog, Ken, is actually one of those predictors of loneliness.
Absolutely, and loneliness is a big deal.
Live longer. So I'm glad to hear that you have a dog. And I think many of us own dogs. And I think we ought to stop a moment, though, and talk about what are social determinants, because some people may not even know what the definition is.
Sure. So there are different aspects that impact the health of people in general. And it can be everything from their ability to get to healthcare appointments that they have with their physicians in a timely and regular basis. It can be their access to nutritious and healthy food. It can be the type of care they're receiving from the community, social services, and other type of extended care or counseling that they might need to support them getting better from an illness or having a chronic illness that needs continual care. So there's a lot of different aspects, and some of the bigger impacted areas of our population are those that are disadvantaged, who have challenges from a socioeconomic perspective, and ensuring that they can deal with their illness, ensure that they can get better quickly, and that they're getting high quality health care. You have to think about more than just their visit to the hospital or to their clinician. You have to think about the social circumstances of their environment, of their family, and of their community that have a dramatic impact in their ability to get better and also stay healthy. And that's ultimately what social determinants of health means.
Yes, I've been very impressed with the number of predictive models in looking at things like sepsis prediction, how social determinants play such a big role on that, and also discharge planning for people. and the whole idea of healthcare literacy, that we often send people through a transition of care and don't really acknowledge the fact that they understand what they're supposed to do when they leave the hospital, for instance, and the environment that they're going back into. And as a family physician, I used to learn a lot from doing home visits on selected patients and better understanding their environment of care from day to day, their support systems. So it's really interesting. So where do you see social determinants being used more in healthcare in 2019?
Well, I think, the way it started is really a recognition of the impact, the significant impact social determinants of health has in caring for a patient. And it was largely implemented initially as a survey that would be entered into the electronic medical record, into the EMR, with very specific set of questions to ensure that as care is being provided to this patient, that there's an understanding of those social determinants of health, those factors that impact them outside of the provider institution. The thing is it goes obviously much deeper than that. And what I believe we're going to see in 2019 is more capabilities to engage with people, with consumers, with patients outside of the traditional healthcare provider environment to address these social determinants of health. So to be able to monitor, for example, the nutrition that and their food choices or access to nutrition that they have after they get treated for any type of a chronic or severe condition, particularly for diabetes, which is a huge cost issue in healthcare today in treating diabetic patients. The ability to monitor the nutrition of these diabetic patients is key, but it's not something that can be done in a doctor's visit. You need a more ongoing engagement with the patient in order to manage that aspect of their care. And so it might be ensuring that they get healthy food. It might be the choices that they're making, but the various tools, the educational material, and the ability to teach people on what to do, like you were mentioning, Phil, are all important. And I think there can be a lot of applications of digital health capabilities to drive that type of engagement with patients and obviously make a big impact in their health.
So in summary, Ken, this idea of social determinants of health growing, what we're really saying is organizations should be thinking about how they're capturing information about nutrition status, home environment, income levels, neighborhoods that people live in, whether or not they have pets, and then leveraging this information in their care decisions. And as we digitalize this background information on our patients, we can then leverage those with other strategies such as machine learning and artificial intelligence and predictive algorithms, and begin to look at ways to intervene in our patient care to promote health and to better treat chronic conditions such as diabetes. So it's going to be an exciting field, and
Absolutely.
it's a lot of data for us to manage, but we do need to be starting to collect that baseline data and figuring out how to best to collect it. I personally think we should be doing more patient collected information and feed
Absolutely.
that into our electronic health records and not be adding that as a burden to the care delivery providers, so that we can leverage that information from and have strategies to know that we're getting accurate and complete information for good decision making. So let's move on to number 2. This is always an interesting one, weeding out digital health solutions. What are your thoughts on that?
Well, I think what we're seeing is that the first challenge over the last couple of years in particular has been an explosion, which is great, an explosion of innovation and people who want to address the challenges of healthcare. Many of these folks are coming from maybe non-healthcare areas, but high-tech areas where they want to apply some of the capabilities of mobile technologies and artificial intelligence and other types of kind of web 2.0, 3.0 type of capabilities to healthcare. Obviously, there's a lot of pain points and a lot of challenges in healthcare today. So there's been an explosion of these people who want to try to address that. At the same time, in order for it to be determined to be beneficial and useful, they need to engage with the healthcare providers to prove these solutions out. And so you've had an explosion of people going to these institutions, going to the chief medical information officer like you or Phil, or to the innovation officers of these organizations saying, hey, try this out. It's going to make a difference. It's going to improve quality of care. It's going to lower your costs. It's going to address the triple aim. And you have this explosion of pilots and in these particularly academic medical centers, and they can't handle it all. It's too much. Trying to figure out which one is the right one is challenging. So where does that all fall out? Ultimately, I think that, you have solutions that might be quite innovative and quite interesting, but, do they really move the needle on healthcare and improving that quality curve or the cost curve? And
Yeah,
I think that's a big challenge.
yeah. I was talking to a health IT vendor that has a very innovative project going on. And I was explaining to them that at the health system level, we get the opportunity of the decade about every week. And they come in and everyone has the newest widget and it's the best thing since sliced bread. And people, want us to pilot it or to look at it or give their time. And they have no perspective of how many of these opportunities come by our table during a year. And so on the health center side, what you do is start developing these screening algorithms in your mind, and you begin to look at how can I say no to this opportunity as quickly as possible.
Right.
And so the weeding out is actually a process, and you look at it and you say, okay, are they giving me a value proposition? Is this a team that I can work with? Do they have any published proven benefits, or is it just hype? And when I look at the information that they provide, is it trustworthy and accurate? So if those hoops aren't jumped through, it's real easy just to say no and stop it right there, because we can't spend hours and hours reviewing everything that comes across our plate. And we've seen an explosion of things. So
I mean, it's incredible when you look at some of the numbers, like a paper from RX Health, which stated there's almost 315,000 digital health apps in the market. That's a huge, huge number. So ultimately, my point is, I think that it's gonna get weeded out because there needs to be clinical validation. There needs to be, you need to pass that first hurdle that you're really addressing something significant, right? And then once you've passed that hurdle, you need to be able to collect that clinical evidence that shows that it truly can make a significant impact in the quality or cost curve, or hopefully both, for it ultimately to be successful. And those are hard hurdles to cross. And that's why I believe, we're going to see some, honing in on the type of applications that have the biggest impact in the marketplace.
I think the other thing that impacts health systems is the fact that we have such a large investment in health IT around our electronic health record, around our financial systems, and our what I call our employee relationship or resource management systems, that we really don't have a lot of bandwidth to look at all these niche solutions that are coming out there. But yet the niche solutions are where the innovations are happening.
Absolutely.
So it's going to be an interesting year as people sort out how to get in front of the right people, how to get their pilots, how to get their validations.
And some may say, I'm just going to go straight to patients, straight to consumers. But, there's challenges with that too. It's very hard to get a patient to want to, pay for something, first of all. separate from their what they're already paying for healthcare and for their high deductible plans and the like. So going directly to the consumer is very, very difficult. Certainly, you might see some people start out that way because they can't get the attention, but then needing to pivot back, because that's ultimately where you're going to be able to scale, is by working with providers and insurers and self-insured employers and the like.
So this, in summary, is really an impact to all those who provide care, getting inundated with lots of digital health solutions and knowing how to sort through those. And for the vendors themselves, creating advanced strategies to validate what they're offering and figuring out how to get it into real life clinical situations where they can prove what their solution is actually making a positive impact to patient care in the laboratory of life and not just in an academic study.
And you might
Okay.
see more curation of that as well.
Yes, absolutely. Absolutely. Okay, well, let's move on to your third one. Artificial intelligence, machine language will continue to grow. What are your thoughts on that?
Well, there's so much out there about this, and there's so much buzz in this space. And there's no question we're seeing a huge shift to solutions that employ these techniques. You look at something that's been around for a long time, NLP, natural language processing, and its application in healthcare, and the fact that it's something that I've worked with over the past number of years as well, and at eHealth is, how does that get applied to this whole variety of data that's out there that's unstructured about patients, and how do you extract value from that? Certainly, there's been applications of this around, improving coding, and so that's one of my points. Leveraging artificial intelligence to the revenue cycle management aspect of institutions, I think, is something that's going to continue to expand, because it's pretty, you have a pretty defined data set, and you're going to have a pretty obvious ROI if you can more efficiently, for example, determine coding for patient encounters. So I think we'll continue to see that advance. When you look at the clinical side of this, I think we also have our headwinds to this, which is simply the fact that you do have a wide variety of data that when you go just beyond the standard, data set for a patient, you have lots of information that is not standardized, that's unstructured, that's siloed, that's not interoperable, and difficult to gain access to and difficult to extract accurate information out of. And I think that's going to continue to be a challenge. So as you get to more clinical use cases for the application of artificial intelligence and machine learning, I think we're going to progress a little more slowly, largely due to the data problem. Nevertheless, there are some very interesting things going on. For example, the application of this for analyzing medical images. There's really cool stuff going on where, from screening of imaging that can really make care more efficient. When a lot of the images are generally going to be normal, and you can use a machine learning tool to identify the ones that aren't, and then have them have the radiologist have the time to review those and assess the ones that are tagged through these types of techniques. Or, there's a company that's looking at cardiac MR and can automatically get all of the cardiac functionality out of those cardiac MR studies through the application of these types of tools. And it's fascinating stuff. So I think that's going to continue to advance. But when you're looking at solutions that are tied to the crazy amount of data and the difficult nature of that data, I think we're going to have some headwinds as well.
Yeah, and I think to your point, AI has created an opportunity in imaging to create a lot of sensitivity in deciding whether a study is normal or not normal but it still is lacking on the specificity, which is to say exactly what is abnormal.
Right.
And we need to evolve our business model. So I would love to see us to be able to screen all CTs out in the communities and MRIs in the communities, and then have tertiary centers that then automatically get referred into centers of excellence to read studies that fall outside of the norm. And I think that is not the way healthcare is structured today, and the business model isn't there to really support that yet in the payment system. So it'll be interesting how that evolvement occurs. And we previously talked about the social determinants playing a role also. But I think the big thing for our listeners is that there's a large amount of unstructured data that comprises the health records, that we still have challenges on taking that unstructured data. But we're making great strides by combining natural language processing, or NLP, with AI algorithms and figuring out how to make sense of it. And radiology reports are one that we're actually seeing a lot of success with. So I think that's the one we should probably see a lot of movement in 19.
It's going to continue to advance, no question.
Okay. Well, I have to laugh about the next one, because interoperability to me is something that I said back in 1999 that the only solution was that we needed to create a standardized way of storing information, and then let the EHR vendors start to move the data to the users in a more appropriate way. And today I see we have as many problems with technical interoperability, but we also have problems with communication interoperability, where we have miscommunication among the people delivering care and the people deciding policy. So I want to say that in this case, we're talking about technical interoperability, and I'm currently in the process of doing a 12-part series on the human interoperability challenges.
Fair enough. Yeah.
And getting people to talk to each other and to understand those challenges. But why do you think we're having so many challenges with interoperability?
Well, I think, people for a long time have used the example, well, if we can make the banking system interoperable, why can't we make healthcare interoperable, right? and the simple point of fact is in banking, you have a very limited set of very well-defined information. You're counting money at the end of the day, right? And account numbers and the like. Healthcare is many-fold more complex than that. And, ultimately, we also have a lot of information that's very valuable information that's generated in healthcare today that is simply not part of this, the least common denominator approach that so far has been applied to getting data to be more interoperable. So when you look at the consolidated CDA or the continuity care record as it's defined, this minimum data set that the ONC and CMS are focusing on from an interoperable perspective. It's important information. It's making sure you have the medications right, which I know is another interesting topic you've addressed. Problem lists and allergies and care plan. And yes, those are important clinical elements, and it's important for those to be interoperable. And it's a great initial step into ensuring data from different systems is made interoperable and shareable and can be combined together to look at the entirety of this patient's health record. But there's so much more. There's the radiology reports you were mentioning, the operative notes, the consult notes, the pathology reports, other types of unstructured data that are simply not accessible, but they're very, very important aspects of the health record. They're important if the patient's diagnosed with cancer or needs surgery or is going to have a transplant or has, chronic, congestive heart failure or other types of chronic illnesses. You need to understand the complete nature of the care that they've been provided over time. And we're still at, I think the early stages of being able to fully capture that entire health record of the patient and make it accessible and interoperable across healthcare providers.
Yeah.
And the simple fact of the matter is patients see more than one doctor and they go to more than one facility, particularly with chronic illnesses. There are 3, 4, 20 different providers that they're, working with, and how do you pull all that information all together? It's extremely difficult. And I think there's still a lot of challenges, and it's going to be frustratingly slow to continue to address those challenges. I don't know that there's a lot of motivation once you get past that minimum data set that's kind of coded into the, reimbursement and the policies that exist today and what EMRs have to do. I don't know that there's the intrinsic motivation to ultimately do the hard work to address this. And that's why I'm afraid that the progress is going to be slow.
Yeah, I think the other problem for me is that minimal data set, and let's call it the kind of the PAMI data set, problems, allergies, medications, and immunizations, is inherently inaccurate in most electronic health records. And I have to kind of laugh every time I go to a physician and see my clinical summary that they hand me now when I leave. And it seems like over your life, every lab test that you've ever had, someone had to justify it with some insurance code. And you look at what's been captured in your record and you just throw up your hands and say, oh my goodness, all these rule out things end up as problems and diagnoses in your electronic medical record. And I don't want those things interoperable with my next physician or in decision making or machine language algorithms, because it's going to make assumptions of who I am and what I really have. So I think we've got challenges, and I think for the end users, the thing for me to say is it's time to start really looking at the stewardship of our medical records and recognize that garbage in, garbage out mentality is going to come back and haunt us in the near future. Because if we ever do create true interoperability, we're going to have a new problem, which is all the garbage that's in the electronic medical record through billing processes and practices that are going to really make it difficult to do medical decision making because of all the variances that we're going to have. So
and the issues of patients being able to have any say over that as well. I mean, I look at my medical record that's in Epic in my local healthcare institution, and I got a flu shot at work, but yet there's no way for me to just easily say I got my flu shot. Stop reminding me to get my flu shot. I got it. And why should that be so difficult? It shouldn't.
Absolutely. And that's some of the stuff I'm addressing in the book MedRec, how we need to start with just one simple thing, which is a single source of truth for medications in the United States. It's ridiculous that if you're seeing 3 doctors and you've been to 2 pharmacies and you've been to 2 hospitals, that you have distinctly different list of what medications you're taking, and every time you walk into those systems you end up with mistakes as a result of that. And we need to solve it by starting with one simple thing. And I think medications has a lot of benefit because the risk of medical error from medications and adverse effects is extremely high and has a huge economic impact to us. So
yeah, we could go into a whole big long discussion about that too.
Absolutely. Okay, well, let's move on to number 5, which is faster adoption of the FHIR resources. So
well, this is the opposite side of that interoperability coin, and where I wouldn't have predicted necessarily a couple of years ago that we would have had the progress that we've had, but due to some great efforts by a lot of people. I think of the Argonaut Project and the people who are promoting this moving forward, and how HL7 has stewarded it, with Chuck Jaffe and then Mickey Tripathi and other folks who have been involved in this. It really has accelerated faster than I would have predicted. And so I think this can be, nothing's a panacea, but the growth of FHIR, which is this fast healthcare interoperability resource, it's a modern web-based API to gain access to specific medical information that you might need from an EMR, is something that I think can be a true catalyst to accelerate interoperability and the usefulness of digital health applications overall. I think there's still a long way to go. There's still aspects of ensuring semantic interoperability, of ensuring that the data that's, let's say, generated out of some of these digital health applications, maybe some of the learnings from artificial intelligence, machine learning, can be fed back into the EMR. I think that continues to be a big challenge here, but it's been great progress so far, and I've been impressed with how well this has gone, particularly when you look at the survey by CMS and showing that almost 80% of the installed EMRs today are capable of deploying FHIR-based applications.
Yeah, and I'm excited about the ability to leverage this for patient-reported information and
Absolutely.
getting the patients more involved in their care. We've put way too much burden on the people in their offices and physicians and nurses on documentation. And really, we should have patients fill out a lot of information and then validate that with them and spend less time on data entry and more time on data validation.
Yeah.
I think it would provide a level of expertise, be a better use of people functioning at the top of their licenses and create more complete medical records. So I'm excited about FHIR. I am looking forward to its continued development, and I think this is probably the one thing on the list that I think we'll see a lot of improvement. But as Bill Gates once said, we always overestimate where we're going to be in 2 years, and we underestimate where we're going to be in 10 years.
Yes. Fair enough.
Okay, so let's talk about the fourth aim. I'm going to set this up a little bit because not everybody knows the triple aim of healthcare that was described by Don Berwick at the Institute for Healthcare Improvement in 2008. And Don put that we should have three things as aims in healthcare. We should improve the experience of care, improve the health of populations, and reduce the cost per capita. And then a few years ago, Dr. Bodenheimer wrote a very nice article that we need to have a fourth aim, which is now called the quadruple aim, which is improving the work life of healthcare professionals. And Don Berwick calls this obtaining joy in work. So I think that's something that we're awfully lacking in obtaining joy in work. So how do you see this playing out in the coming year?
Well, I think what we're seeing is, yes, Dr. Bodenheimer talked about this now, 4.5, 5 years ago, and it's, but I think it's really going to gain continued momentum in 2019. You just hear a lot more about it, and a lot of people saying, we're going to find ways to address this, and so you start to see real attention being paid to this and it being a priority for healthcare institutions as they're looking to retain their physicians. That's an important aspect, and obviously work to reduce the very high levels of burnout that are reported in the industry, upwards of 50% or more from the standpoint of physicians out there. And so this is a real problem that absolutely needs to be addressed. And certainly EMRs have been a significant factor with the amount of additional administrative work that's been put on to these clinicians over what they have been trained for, what they've been used to previously. And ultimately, it's a desire for physicians to, another term that's used, to practice at the top of their license, right? They want to be able to spend time with their patients. They want to be able to think about what's going on with them and to be able to bring their best clinical knowledge forward to help their patients get better. And a lot of times the administrative work is getting in the way of that. And there's other discussions out there that for every hour of time with the patient, they're spending an hour on the EMR. So it's crazy the amount of effort that it takes. So there's a lot of interesting things going on in the digital health space to try to address this, and the applications of artificial intelligence. To be able to take the verbal interaction that a physician has with a patient and to be able to capture that, analyze that, and use that as a basis for what goes into the EMR, making that process a lot smoother, is just one avenue. Overall, I think that there's mechanisms to make EMRs easier to use, to automate certain functions that can be automated, but overall, really think about what it is that can give that clinician more time with their patients. And I think there's a lot of applicability in technology for that. But I think that's going to continue to expand in 2019. I have a good friend who is a retired pediatrician who's working with a company that is, focused on measuring, truly getting kind of validated clinical measurements, kind of the evidentiary-based measurements of this dissatisfaction and this burnout and what's contributing to it. And I think as we collect more of that data, that's going to then feed into what could be done at least from a technology perspective to help address this. It goes way beyond technology, but there's no question that technology can play a role.
Yeah, it's interesting. A couple of things I learned back in 1992 when I started looking for an EMR for my own practice. I wanted to make sure that I figured out how to make the EMR my tool and not me be a slave to the EMR.
Mm-hmm.
And I redesigned the office, and it was interesting because my associate, he approached the EMR completely different than I did. And today we're learning that there's this process of what's called cognitive overload from the EMR. And I got to see it early in 1993 by doing my notes immediately. So I would take care of the patient immediately after I was finished examining it. I would have the patient stay in the room, and I would actually complete the note right then. And I found that I actually come up with another question or two I could ask, or that they would actually ask questions. And it began to help the patients feel like I actually had spent more time with them, and they didn't see the EMR as an intrusion. And then by completing the notes, by the time they reached the front desk to check out, the notes were actually already in the electronic record. And if the patient had a question that they didn't address, my nurse immediately had access to it and could answer it. And then we started calling the patients back the next morning who had been in for an acute illness or started on a new medication, and proactively seeing if they had any questions or concerns. And so we ended up cutting 2 hours a day out of my office.
Wow.
Of my time. And we cut out 80% of the calls that were coming into the office and tying up our staff, because we were proactively using the EMR as a tool. Where my associate was saving all the notes till the end of the day to put them in the EMR, he actually added 2 to 3 hours a day to his workload. So I think this cognitive overhead, when you have to recreate a note later in the day and document it, it actually takes over 100% more work and cognitive effort to reproduce that note. And so I look at every opportunity to let providers and people to support providers know that if we can get doctors understanding how the EMR can be used to be an efficiency tool, you can cut a significant amount of hours. And I ended up getting to the point where I was saving 66 hours per month, which
Wow.
was giving me back a week and a half every month of my time. And also the EMR, I learned ways to make my practice more profitable. So it can be done, but most people are not putting the time into this effort. So I hope this idea of the fourth aim gets out more into the public domain and people really understand it. And I'll
I think it
probably do
will.
a series on this year.
I think it will. I'm seeing a lot of expanding of this in the industry. So it's good news.
Great. Okay, well, this is probably near and dear to my heart, which is a focus on patient-centered care. As a family physician, that's always been my interest, but what's your take on that?
Well, I think that's one of the particularly, uh, it's a great alignment between what's happening in digital health and really the advancing the care of patients overall. And that's the ability to engage with them um, in a way where they have more control, right? And where they have more access to information. And, so there's just a really obvious uh, virtuous cycle here, right? Which is if a patient is treated for illness, and then they obviously there's a goal. You don't want to be in the hospital any longer than you need to be. And then once you're home or you're in an extended care facility, the last thing you want to do is go back to the hospital. But the key to that is the adherence to the care plan, the adherence to the medications that you're supposed to take, or physical therapy, or other types of ongoing treatment that you're going to receive, the nutrition that we talked about before, and following those guidelines, et cetera. And if the clinicians and the healthcare providers can engage with the patients after they've left the institution in a way that supports that engagement, and for them to do what's needed to do to care for themselves and ensure that they get better, and don't run into further complications, digital health provides a terrific platform to enable that type of engagement. And again, it's a virtuous cycle that I think ultimately will help. And as you get more and more of care being reimbursed through value-based reimbursement models, then this even makes more sense, because it reduces those readmissions, and it overall lowers the cost of care for patients with these conditions. So that's why this is key. I think it's one of the best applications of digital health that's out there. Almost everyone has mobile technologies. There's a lot of work being done in this area, and I think we're going to continue to see explosion of capabilities focused on patient engagement and patient-centered type of care.
Super. Well, Ken, as we come to my final question for you, every one of us is a patient, and you certainly are a patient. You have loved ones, you have family, friends that are impacted by healthcare. So what's your biggest recommendation of what you would like to see healthcare to solve in 2019 to help you and your loved ones?
Well, I think that this last point that we've just brought up was last for a reason. It really is probably what gets me the most excited about digital health in 2019, and the patient engagement, the patient-centered care really leverages everything that the other 6 items that I brought up as far as the trends of 2019. Everything from the applications of artificial intelligence and machine learning to ensure that, for example, patient-reported data can be analyzed and then incorporated into the EMR, into care plans, into what the clinician sees, to the types of, even what we just talked about, improving physicians' lives, right? If they have better ways to ensure that patients are getting taken care of after they've left their care, then the care that they've provided has become more meaningful, has become more impactful in their ability for their patients to get better, and ultimately brings more satisfaction to their role, I believe. So that's where I think this growth in patient engagement and patient-centered care is the most exciting to me for 2019, and again incorporates all these aspects that we've had conversations about with today.
Okay, great. Well, I'm going to be posting your complete predictions on YouTube when I post this video, but also you can follow what we're doing on Facebook. And I really thank you for giving us time today. How can people reach out to you, Ken, if they have any questions?
Well, you can find me on LinkedIn under Ken Rosenfeld. Also, my website is authentic-strategies.com.
Okay, well, thank you very much, and I've enjoyed this time, and I hope that our audience has gotten some value out of this.
Thank you so much, Phil. It's been great talking with you.
Thank you.